What did you put on my head? That
There-
it feels like it's pulling back.
We have the little wrap there. Hello, everyone. Good morning. Dr. Rich Castellano here, the Smile Doctor. And we are here with Yvonne. And thank you, Yvonne, for letting us do your video with the treatment today. Yvonne is going to be doing a image lift procedure under local anesthesia. Yvonne, do you feel that relaxing medicine settling in?
Yes, I do.
Okay, good. So what we're going to do is, let me show you. This is Yvonne's pictures, and it's been a while back. She had a lift done in the past, and so she's one of our A+ students looking for extra credit. She looks great, but she wanted to tighten up here along the neck and the jawline. And so the last time you had a lift, it was under general anesthesia, correct?
Yes.
And so you see these areas under here, that's really where she wants to focus. So she will look natural. We'll go for the most improvement possible. And you have many active years ahead of you, Yvonne, so we're honored to be taking care of you. Can we share with them how young you are, dear?
Yes.
How young are you?
I will be 70 in September.
70, wow. And you look so good, and we're going to make sure that you maintain. People are living so much longer nowadays, and they want to look their best. Good morning. Hello, Rashid. Thanks for watching. Hello, Denise. And so that's our job, is to make sure they know their options and give them the best results possible, because they don't want to do traditional procedures. So when you had your procedure done the last time, you were put out completely, Yvonne?
Yes.
Okay, so that's not necessary for what we're doing today. And what I'm going to do is I'm going to do some of the tumescent solution, the numbing medicine. So I'm going to zoom in here for everyone to see, for the physicians and students who are watching. We're in Tampa, Florida, and the Villages, Florida. So this is tumescent procedure. We're going to be doing a SMAS plication. And Ari, my team, they have everything set up perfectly for us, makes it very easy.
Of course.
So Yvonne, you had a chance to read our book.
Yes, I did.
Was that helpful to you?
Totally helpful.
Okay, good, good. What was it that made you decide, how come now you wanted to do another lifting procedure?
Well, when I was looking in the mirror, I didn't like what I saw. The way that my face was starting to look, it wasn't what I'm feeling, the way I feel inside.
Uh-huh.
And I do have many years ahead of me.
Yes.
And I want to, do many things now that I'm retired.
Good for you.
And I want to have, a good self-image.
What kind of work did you used to do?
I used to be an assistant principal in New York City.
Wow. Oh my goodness, you must have so many stories to tell. Oh my.
I do.
Okay, well, that's wonderful. Well, we're honored to be here to take care of you. So I've got my gown and gloves, and Ari has everything set up nicely. Thank you very much. And then, now, what we'll do at this point, and thank you for the comments and questions, and thank you for sharing. Definitely share with your friends and let them know. So I'll use my marker now, and then I'm going to turn the chin up just a little bit here. There we go. That's perfect. And so there's just a little previous incision line. We'll go right through the same place. Patients will ask me, they say, is it okay to make the incision in the same place where you did it the last time? And the answer is yes, we can. When you have the right doctor, you absolutely can. So I'm doing 1% lidocaine with 1 to 100,000 epinephrine. Now, I did a little bit of numbing there before, so you may not really feel that much right here. But I do across the incision line, and we also did some of the Bella fill before. That's the long-term filler, permanent filler. We did that before we started the video. And then this is the tumescent solution. So we use the spinal needle. Good morning. Thank you for watching. Thank you guys for sharing. So, Yvonne, you feel a little bit of pressure pinching here?
Yeah.
You feel big pinch, little pinch, not too bad?
Not at all.
Okay, you feel a little pinching. If you need a break, you let me know. Most patients will say, no, you're fine. And we do the numbing little by little by little, and then after we're done, they don't feel anything at all. That's the goal. So you can see, after doing 4,000 lifting procedures this way, it's really not necessary to do traditional facelift. Patients don't want that, and they can get very good results. I feel even better with this type of technique when you're going to look natural, you don't go overboard, and you avoid the risks of the general anesthetic. So you feel a little bit of pressure, a little bit of pinching here. For our lift today, we're going to be doing, you feel a little pressure pinch there?
A teeny tiny.
Okay. We'll also be doing some laser lipolysis. which I like to use to help remove some of the fatty tissue and tighten the skin. It creates a thermal injury under the skin. So this is a tumescent solution. We put a bicarbonate plus lactated ringers plus the lidocaine with epinephrine. The bicarbonate reduces the acidity, makes it easier to tolerate and more comfortable, a little pressure pinching. So it takes about 10-15 minutes to do the tumescent technique and numb the entire face. And so for that amount of time investment, it's just far superior. You don't need an anesthesiologist, you don't, for this type of procedure. And, you know, my apologies to my brother-in-law. He's an anesthesiologist, but we just don't need him for this. We need him for other things, but not this. And no surgical drains, no surgical staples. Thank you all for watching, and thank you for sharing. We're also on Instagram, Image Lift now on Instagram Live, and on Facebook. If you're on Instagram, check us out on Facebook, facebook.com/ImageLift. If you're on Facebook, check us out on Instagram, and we're also on YouTube Live as well. And a lot of patients are unaware that you can do things like this. So that's why it's so important to share and to show so that people know what their options are. And in today's world, so here's the basics of what we do in facial plastic surgery is 4 things to improve the appearance. If we sag, then we're tightening, and that's what we're doing today. We're going to be doing some tightening. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. And then the 4th area that improves our appearance is better than all the others, and that's our behavior. And Yvonne, you know the power of smile. You're a good smiler. Mm-hmm. And so nothing we do looks as good as our behavior, and we tell all of our patients that. And then there's 4 principles to good plastic surgery. Let me turn your head this way a little bit. Safety first. I have an outside consulting firm. They monitor all of our practices. We always want to make sure that we're constantly raising safety standards. Safety first, number 1. Number 2, you must look natural. Number 3, prevent future aging changes. Number 4, let's get as much improvement as possible. So these are the things that we focus on to get the best results. Perfect. And so, but you have to keep in mind for good plastic surgery, we never see ourselves the way that other people see us. Sometimes we can be a little hard on ourselves. And so you want to be practical. And there's a physical reason why we don't see ourselves the way that others do. Because when we look at other people physically, the physical act of looking at other people, you feel a little pressure pinch there, Yvonne?
A little.
Okay. I'm not in a hurry if you need a break. She feels a little pinch there, but then that's going to go away. Okay. And she also asked me from the previous lift, she felt her ears were attached down, so I'm going to try and make that curvature come back a little bit so we can correct that. If you know someone that's had a lift and they want a correction on the earlobes, we can help with that. So when we physically look at other people, we will glance at them, and we're social. We move our face. So there's glancing, and there's movement of the face and social behavior. But when we look at ourselves in the mirror, we do not glance. We stare and we glare and we are critical and we're serious. Now, it makes you feel bad to do that to yourself. Now, if you stare and glare just critically at other people, in less than a second, they'll tell you, stop, don't do that. We should not do that to other people, and we should also not do that to ourselves. We should feel a little pinching. There's a little more sensitive in there. Some of the scar tissue from the previous procedure, so feel a little pinching. We put some of the numbing, and then she doesn't feel it. How are you feeling now?
Okay.
We're also going to be using some of the bruise patches later, and thank you to Sierra Occumend. They send us the bruise patches to use to put in our videos, and so that's full disclosure. But we have been using arnica for years in our patients. There's plenty of research to show arnica montana is effective for bruising and swelling. So the bruise patches, the Occumend from Sierra, they help because they are transcutaneous transmission of the product, and our patients have been getting great results with that, so we're enjoying using that product. Thank you very much to Occumend and Sierra for allowing us to use that, and we're going to use that for Yvonne. We're going to use that for Yvonne, so that way we try and minimize her bruising and swelling and help her recovery. So, good morning. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. And Yvonne today is doing an image lift facelifting procedure under local anesthesia. I'm going to turn your head all the way to your right. Is that position okay for you like that?
Yes.
Very good. Good morning. Thank you for watching. So as you can tell, I'm frequently asking the patient, how are you feeling? You doing okay? So we monitor blood pressure, we monitor heart rate, we monitor oxygenation while we're doing the procedure if they feel comfortable, even a couple of the relaxing tablets. And so if she feels relaxed, she'll tell me. And some she's drowsy, and we wake them up when they're done. And they are arousable. She feels a little pinch, so we'll go around and we'll do a little more numbing there. And if a patient feels they need more relaxing medicine, then we just give them more relaxing medicine. So the numbing is the worst part of the whole procedure. After the numbing, people can't tell what it is that we're doing. So they know where we are and they feel it getting tired. Yvonne, do you think you need a little more relaxing medicine, or do you feel
Yes.
comfortable?
A little more.
A little more? Okay, you're going to hit the button. We're going to give you another little relaxing tablet because you had two.
Yes.
And what's going to happen is people, they may drift off or fall asleep. Tell me what you're feeling right now.
Like tightness.
Okay, so now I'm going to use the 1% lidocaine with 1 to 100,000 epinephrine. Good morning. Thank you for watching. And thank you for sharing. Make sure you let your friends know that you're watching live procedure, because if you tell them that you saw this and you didn't share it with them, they're going to be upset with you. Let me turn your chin all the way up like this. So people ask us, they say, well, how much do these things cost? You can go to our website, imagelift.com/pricing, and the information is there. Or just give us a call, 813-463-9245. So for the students and physicians that are watching, let me turn your head all the way this way. You can see the lightness of her skin. That's the epinephrine taking effect. And that causes vasoconstriction. So the vasoconstriction just means smaller, constricting blood vessels. And that gives us a couple of purposes. You feel a little pinch here. One thing the vasoconstriction does is it helps to reduce bleeding, which is always something that surgeons appreciate. And then that also helps to keep the numbing medicine there a little bit longer. Now the dosing of the lidocaine is 7 milligrams per kilogram is the dose you're allowed for lidocaine with epinephrine. It's without epinephrine, it's 3, so it's a smaller dose because the body clears it more easily. And you can redose approximately every 90 minutes. And so now I'm just numbing across the incision line. And with the tumescent solution, there's about 250 milligrams of lidocaine, and then I'll do another 10 cc's of 1% epinephrine straight. Little pressure pinch. So we're well below the dose. Let me turn your head all the way this way and turn. Very good. Thank you for watching. Thank you for sharing. If you're just now joining, you feel a little pressure pinch here. You feel a little pinch there?
A little.
Okay, good. Everything's looking good. You're gonna love it.
Mm-hmm.
It's important for the physicians and students that are watching. You have to communicate with patients, let them know everything's going fine. To the platysma muscle, so a little bit of the fatty tissue there. Thank you all for watching. Thanks for tuning in. Hope to see you soon at our next event. We'll be in New Orleans later this month, and then we'll also be in Las Vegas in July at the Wynn Hotel at the Aesthetic Show. And looking forward to seeing you there. We'll be doing some live video from those areas as well, interviewing doctors from all over the world. Yvonne, how are you feeling, dear?
Okay.
Everything's looking good. And this area that was bothering Yvonne, as I'm looking straight on here, I can see this is the fatty tissue that's directly in. There was just like a little bit of a pouch or a little bit of a bumpy area. And I can just directly remove that. And then we're also going to be doing some of the stitching, of course. The corset platysmoplasty, as it's called, because it's kind of like tying things up like it's a little corset. Okay, so now I've trimmed a little bit of that fat. I'll use the bipolar cautery. So I'm just going to adjust this over here. Perfect. Welcome. We're in Tampa, Florida, and in the Villages, Florida. Thank you for watching and thank you for sharing. Everything's looking good. You'll see me bring the light in and out, gives a different perspective, and so it may change the white balance just a little bit from where you're watching. We'll readjust that when we're doing the sides of the facelift as well. Perfect. Now, Ari, can you show me on the other side as well, please? Thank you. It's so important to have good help in the office and an amazing team. And the only way you get an amazing team by hiring well, but you've got to train your team. And throughout most of my medical career, I've seen doctors' offices would hire good people and then do very, very little training or leave the training to the vendors. But you've got to take that training on yourself if you want your best result, because no one has your practice best interest at heart the way you will. So you've got to train your staff and make sure that they have what they need. That's why we do practice profitability. Now release for a moment there. So then, expose right here for me, please. Just a little bit of gauze. Now release again. So already just by trimming and contouring, I like the symmetry. I feel the profile of the jawline here. Very good. Yvonne, how are you feeling, dear?
Okay.
Very good. So now I'm going to use the Ethibond. Perfect. Hello, Eric. Good to see you. Hope you're doing well. Yeah, exposure is fine. So now I'm doing the corset platysmoplasty. I'm going to use my other needle driver. Perfect. So I'm grabbing the platysma muscle on one side, regripping, and then now I'm grabbing the platysma on the right side, and it'll bring them together right near the chin, or the submentum as we call it. There's physicians and surgeons, we have to have all these fancy names for everything. Makes us feel very important, but it is good to have a terminology that we agree on and can accurately describe what we're doing, where we are, and how we're taking care of our patients. Thank you all for watching. Thank you for sharing. If you're on Instagram, please look at us at ImageLift Now. ImageLift Now for Instagram and Facebook.com/ImageLift. We're broadcasting live on both for the physicians and students that are watching now. I implore you to do as much video and live video as you can, because that is the primary way your patients will get to know you. As Yvonne was telling us, she came in and already felt like she knew us. That is the number one thing that patients need to make their decision, is feel like they know and can trust their doctor. So give them that opportunity before they even have a chance to meet you. Put the videos out there. Let them see you. Excited to have our big event coming out. We hope you can be there. October 18, 19, 20. We have people, we started with plastic surgeons. We've also had orthopedic surgeons, GI doctors, primary care, VA, military, you name it, have done our trainings. So entrepreneurs, business owners, neurosurgeon, you name it. So we're giving CECME credit on how you can train your team, raise their smile score, connect better with patients, some of the latest technologies and techniques that are highly effective and what are responsible for us having 30% growth in our business in 2018, and we're on track to do that again for 2019. So we love to teach, we love to share, because we care. All right, and if you're a patient watching, we like to use the Build My Bod app. You can go to imagelift.com/pricing, and we believe in price transparency, so patients can find out what costs are for what their type of procedure is that they're interested in. I focus only on the face. I found that patients wanted someone who really specialized, and so when they ask about body techniques, I tell them if I'm doing a facelift, and I pull really, really tight. Sometimes I'll get a little tightening in the tummy or the breasts. I'm just kidding, that's my little joke. But we only focus on the face. Every now and then, you know, I have patients, they want me to do their hands, or we've done some Brazilian butt lift injections with Sculptra, and those things are simple to do, but we really focus on the face. Okay, very good. So now I'm going to trim the stitch, and then I'm going to reassess what we've done. So we've trimmed some of the fatty tissue, we did the platysmoplasty, we did the laser lipolysis. You can see there's some of the fatty tissue that we trim and remove. Some of it, not all of it. Okay, release for me, please. So the contour is perfect. We're going to tighten from these sides as well. And, all right, expose for me right over here.
Sure.
On this side, please. Now that I've done the platysmoplasty, I want to inspect one more time, and I'm going to trim just a little bit of the fatty tissue. Because Yvonne is our A+ student looking for extra credit, the tiniest little things, I mean, you're going to see them. So that's why I'm paying attention to the detail. We want to be meticulous and fastidious about what we're doing. Perfect. Show me the other side. And then one more time with the gauze. Perfect. Yvonne, how are you feeling, dear? You doing okay, Yvonne? Hey, Yvonne, you doing okay, dear?
Mm-hmm.
Okay,
Yeah.
good. And when patients are done, we walk them to their car. There's no recovery time that's required from, you know, staying in the hospital. Yvonne, the last time you had your lift, you were in the hospital?
Yes, for a few days.
Oh my goodness. Yeah. Not necessary to do that anymore. Patients don't want to stay in the hospital, and it's not necessary. That was a general anesthesia. I did not do that. You know, I think you look natural. They did a good job for you, and I'm gonna do some repair on the ears, and that can happen. The earlobes, if they get drawn, that's why again you want to choose the expert that can avoid drawing your earlobes. Very good. Everything's looking good. Thanks for watching. Thank you for sharing. Perfect. I give my cell phone to all my patients. I'm going to turn your head this way. Nice and easy now. They can access at any time. Perfect. Here you go. So this is the 15, and the 15 allows us to make the skin incision. So right through this area. Make sure you're subscribed because we will be rebroadcasting later. Everything's looking good. Perfect. Now I'm going through the similar scar tissue, the same scar tissue she had from her previous procedure. So Ari holds forward the ear for me, and then that's traction she's got. I've got another counter traction where I hold with my tooth forceps. They're called tooth forceps because they have a little tooth at the end that allows me to grab the tissue as atraumatically as possible. Everything's looking good. Yvonne, how are you feeling, dear?
Good.
Are you feeling any pain at all?
Uh-uh.
Okay, good. Some patients remember everything and talk the whole way through. Some patients, they don't remember, or they drift and they're very drowsy. But as long as they feel comfortable, we can do the procedure. Like I said, we monitor vital signs, we monitor blood pressure, we monitor heart rate, we monitor oxygenation. Just a brief review for those of you who may just be joining us, there are 4 general things that we do to improve the appearance of the face. Number 1, if we sag, then we tighten. That's the foundation of what we do here. Number 2, if we lose volume, we fill. We all lose volume. Number 3, if you get sun damage to the skin, we can polish and repair the skin. And the 4th area for our facial appearance is better than all the others. That's our behavior. Nothing looks as good as Mother Nature's free facelift, our smile. Okay. And then there are 4 principles for good plastic surgery. Safety first, you must look natural, prevent future aging changes, and let's get as much improvement as possible. Can't make it perfect. If you need to come back another day and do more, that's better than going too far. Everything's looking good. Thank you for watching. I've done over 4,000 facelifts under local anesthesia. You get the hang of it after a few thousand. And a lot of doctors will retire after 500 or 1,000 facelifts. So that's what our patients are looking for. Now back to the Cons facelift scissors, and perfect. Yvonne, how are you feeling, dear?
Good, thank you.
Everything's looking good. So I'm lifting in the subcutaneous plane. There's the scar tissue from the previous lifting procedure. Now that I've freed up the earlobe here, I'm going to reset that so that she'll have a little bit of curvature when we reattach. You can't always make a change in the earlobe once there's a little bit of drawing and scar tissue there, but usually you can make it better and still it looks natural. That's why it's so important. You want to do things the correct way the first time around and avoid issues of drawn earlobe. Okay, so now I'm in the infraauricular and postauricular area. Perfect. Everything's looking good. Thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're on Instagram and on Facebook. So make sure you're sharing with your friends. They're going to be upset with you if you tell them that you are watching live surgery, but you didn't share it with them. So make sure you share. This is about education. People are confused about what their options are that are available. They'll see something on TV and they say, wow, can that work for me? And they don't know. The real answer is finding the right expert that can guide you and give you advice on what your goals are in your anatomy. It's never one size fits all. Very good. I like to do my follow-ups 1 day later, 1 week, 1 month, 3 months, 6 months, 9 months. I give my cell phone to all my patients. That way they've got access to me. Okay, exposure for me, please. So we've lifted the skin, as you can see. Go ahead, exposure. There's really almost no bleeding, so now we're doing the 2-0 Mersaline. Hello, Danny. Hope you're doing well. So we're in Tampa today, and the Villages office, we're usually there Mondays and Tuesdays. A lot of patients in the Villages, and there's no shortage of people in our area that want to look and feel their best. And it truly is an inspiration that people are living so much longer and really enjoying high quality of life so much older. Please go to Amazon.com to look up both of our books. We guarantee we can make you look younger, and the Smile prescription. So just look me up, Rich Castellano, MD, on Amazon. You'll see our books. Both books hit the Wall Street Journal bestseller list. They're very informative. Perfect. Everything's looking good. So now we've done some of the tightening for the SMAS plication. There are wonderful techniques, deep plane facelift, and they can get wonderful results, but I just find that many patients don't want that. They don't want extended recovery, and they don't want the risk. There are some doctors that remove muscle and glands in the neck to get sculpting, and I just think that's a little too much, and patients who choose us tend to agree. It can certainly work, but again, we want to be a minimalist as much as possible and get the most with the least treatment, the least risk. So we make a little clip that's called flashing the suture for the physicians and students that are watching. and I run the stitch back and forth like this just to cinch down that knot. So I'm cinching down the knot here, back and forth, as we call it, throwing down the suture. That's how surgeons throw down, you know. And okay, that feels great. And I'm going to put another stitch up front here. So for the preauricular suture, I like to use a 2O Vicryl. This is poly-L-lactic acid. It lasts maybe 4 to 6 weeks. And with this suture needle tip, I can even do a little tiny bit of dissection if I need to. And I see something that I want to focus, so I do one pass towards nasal, one towards the ear, one more pass towards nasal / brow. Yvonne, how are you feeling, dear? Yvonne, you doing okay? Okay, good. Are you feeling any pain at all? Okay. Very good. It may sound silly, but you know, doctors really should sing to their patients. When I say, Yvonne, how are you feeling? You know, why? It's not silliness. It's done purposefully so that patients feel better. It makes me feel better. Have you ever met a surgeon or a doctor that needs to manage their stress? I manage my stress by taking care of patients and talking to them. It calms me down, it calms my staff down, it calms the patient down. What could be wrong with that? Nothing. But often doctors may feel it's not professional. You want me to sing to my patients? I'm singing to you right now. And so, of course, my wife and kids roll my eyes when I do stuff like that, but that's okay. They have to put up with me. So, sing. It's good. It's communication. That is the greatest thing that we have as physicians. That's the root word of doctor, docere, to teach. And if you really want to teach, you know, what's the number one thing that everybody's got to learn when you're in school? You got to learn your ABCs. Well, you don't learn the ABCs, you learn the ABC song. That teaches you, and we learn by singing. When you're really learning on the highest levels, we're teaching, we're telling patients you're doing fine. Now, look at the excess skin that we've got here, now that I'm draping, okay? When we drape across, I'm going to take a little, but not a lot. And with this secondary facelift, you usually don't need to take as much. We've done the tightening, but you're just resetting some of the scar tissue, so I'm taking a little bit in through here, and then I'm also going to take some across through here, so her previous incision is going to be mostly removed. There'll be a little bit of, see some of that scar tissue there, but not that much. And then I'm going to put a deep bolster stitch that will bring it all together. So as you can see now, the earlobe is tethered with scar tissue here, so I'm going to free that up. So now the earlobe is nice and free, and it can sit the way that it wants to. So now I'm going to let that come together. You can see that nicely there. Everything's looking good. Okay, so now once that's in position, I'm going to leave this edge right there, and I'm just going to trim through here, and I'm going to trim a little bit in the back as well. And I'm so grateful, my team, they take such great care of me. I feel a lot of love in the office every day, and they take wonderful care of our patients as well. So if you're just now joining, some of you were asking what pricing is. You can go to imagelift.com/pricing, or just give us a call, 813-463-9245. And we can let you know pricing based on what you're looking for. It's not one size fits all, but we'll give you an estimate. And come into the office, we can give you a plan, or come to one of our events, imagelift.com/events. We have free food, we have raffle drawing release. And you can talk to patients who have had things done. We're a complete open book, or look up our books on Amazon. But whatever you do, just at least take advantage of the educational material that's out there. Can you expose, please? Everything's looking good. Thank you for watching. Thank you for sharing. Perfect. So there's really not that much to cauterize, but I like to be fussy and fastidious about things. So now that we've done this mass plication, we're on top of this mask. This mask layer envelops the facial musculature. And right now I'm just cauterizing in the subcutaneous plane. Now, there can be sometimes fluid that can accumulate, and we can either drain that with a needle afterwards, or we put the pressure dressing on, and that minimizes the risk that a fluid collection will even happen. So we will be rebroadcasting later. Make sure that you're following so that you get the alerts and notices when we put more videos out there, because I'll do probably about 170 syringes of filler every month. And then we also, I've done over 4,000 facelifts under local anesthesia. So we really enjoy sharing our technique. We enjoy sharing our patients. And our patients and you is what makes it all worthwhile. It's fun to do these things. It's stimulating, invigorating, and if you can't come out to our event, or maybe you'll see us out in New Orleans or in Vegas when we're there, and we look forward to seeing you there. Now, what I'm going to do next is the 2-0 Vicryl. I'm going to do a deep stitch, and the purpose of the deep stitch is to bring the wound edges together. Sometimes you can even just do the deep stitch alone, so that's the 2-0 Vicryl, and that can bring everything together. But of course, I like to fuss a little bit more over the wound, and I will put additional skin sutures over, just a little bit more cautery here. It's just a dermal bleeding. Very good. Everything's looking good. We're right on track. And we also have a full day in the office off with the procedure. People ask me what day do we operate, and my team, they're so good at putting the schedule together, and we can operate most days Monday through Friday, just depending on your schedule. Every now and then, if it gets busy, a tough schedule, maybe we'll do a Saturday morning procedure, and then the rest of the day I'll just go spend with my family. But usually it's Monday through Fridays we'll be doing procedures. And then seminars usually are either Tuesday, Wednesday, or a Thursday. We'll do 3 or 4 seminars in a month. And I need to find out when our next seminar is. I know I'll definitely be there. Yvonne, everything's looking good. How are you feeling, Yvonne? You doing okay, dear?
Mm-hmm.
Okay, good. Are you feeling any pain at all?
Mm-mm.
You feel that relaxing medicine?
Mm-hmm.
Okay, good. I feel pretty relaxed too.
That's important.
And Yvonne will sound like she's talking like her lips are numb and goofy.
Yes.
That's because of me. That's the numbing medicine, and that's going to settle. That will go away. The numbing medicine lasts for about an hour afterwards.
Okay.
Now we're going to use some of the bruise patches as well. Hello, thanks for watching, and thank you for sharing. If you're on Instagram, make sure you're following us on Instagram on ImageLift Now, because we'll be posting content there as well. But we'll be using the bruise patches from Acumen Sierra. The full disclosure is that they send us patches when we show them on our patients here, and doctors been using Arnica montana for many years. Plenty of research to show the efficacy of Arnica, and now that they have the transcutaneous patches, it's wonderful to deliver directly to the source of the healing. In all of my practice, with any medicine, there's the theoretical possibility of overdosing or having a reaction. I've not ever seen an Arnica montana reaction or an overdose, but certainly those things are possible. So make sure you are getting appropriate advice from your doctor about before you use any types of Arnica patches or any type of medicine, really. Everything's looking good. Thank you for watching. Thank you for sharing. You hit the button for me, please. We will be rebroadcasting here. So make sure you're following ImageLift ImageLift now on Instagram and facebook.com/ImageLift. We're also out on YouTube. Look us up on YouTube. So now I am reshaping the tragus here. And we'll stitch through that area, and then to make sure she's got good positioning of the ear, I'm just going to trim just a little bit of skin through here. Not that much, but just enough. So that way it hugs the undersurface of the ear. And it fits just nicely, just perfect. Okay, now I'm using a 5/0 chromic, so you can see here. One more time on the button, you can let the suture go. And then recycle the BP form, please. Thank you.
You're welcome.
Very good. So between all the 4,000 facelifts that I've done and all the other procedures, I must have thrown at least 1 million stitches. That's a lot of stitches. But I like technical things. I love to do surgery, love to do fillers. It's very artistic. I love to do puzzles. I love to play a lot of tennis with my boys, my wife, and then, of course, I do enjoy playing guitar. I don't play as much guitar, but it is very relaxing, and it just I love keeping my hands busy. Everything's looking good. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. You can look us up at imagelift.com or look at imagelift.com/pricing if you're interested in the pricing. Come out to our event, imagelift.com/events. Very good. Okay. And make sure you come out to our event, October 18, 19, 20, CME event for physicians, students. We will have physicians, students, multiple specialties will be represented. We will sell the event out at the Tampa Convention Center. Go to ppmdlive.com or Practice Profitability MD. We will teach you how we do profit lifting. If you need a profit lift for your practice, you need to be at the Tampa Convention Center in October. We will see you there. I'm retaining a little bit extra skin here because I want to make sure we preserve the shape of the tragus. The tragus is that little piece of tissue that's in front of the ear canal, helps to prevent some things from getting into the ear. And it's the Latin word root for goat. It's like a little billy goat's chin, a little pointy structure. The tragus and the antitragus is here, and then the intertragal incisura is in between the two tragus. Little ear anatomy. Just came back from Austin, lectured out at COSM. Just a brief lecture talking about how to do a consultation. I'm going to trim just a little bit of skin here because I can see the skin's kind of coming underneath an R. I'll need you to pull the suture out exactly the other way. That's perfect. So now I just see where the earlobe is laying, and I'm going to take a little bit more skin. And we don't want tension on the earlobe. That's what causes the drawn earlobe look. So we are doing the opposite of that. We are creating, where it was a little drawn before, now we're creating a little shelf underneath. Okay. And Ari has everything set up perfectly for me. Thank you, Ari.
You're welcome.
Okay. So we did do some of the Bellafill before we started with Yvonne. She wanted the long-term filler. Bellafill has 3 different FDA approvals. Perfect. A 5-year FDA approval for the nasolabial folds, and FDA approved for acne scarring. Very good. And as we finish, when we put the wrap on, before we put the wrap, we'll be putting some of the bruise patches on. And then the bruise patches, you change those about every 6 to 8 hours. And we will show Yvonne how to do that. And I like to see patients back 1 day later, 1 day, 1 week, 1 month. And if they need me before, they can just come in basically at any time. But usually that's enough for most people, 1 day, 1 week, 1 month. And then they make phone calls with any questions. The wound care is started by the patient 48 hours afterwards. You take off the wrap, you can hop into the shower. You can get wet, soap and water. Don't soak, but you can get wet. And then, once you towel dry, you do a little peroxide and Vaseline in front and behind the ears. And then do a little gauze and 1 or 2 of the brown wraps that we give you. So we're wrapping up here. We're gonna restart the video for the other side. It takes just a moment to do that, so make sure you are following so that you get the notification. And thank you for sharing with your friends, letting them know there is live surgery that you can watch on awake patients. The safest way to do a facelift for sure. And we have an outside consulting firm. They monitor all of our practices. You always want to be raising your safety standards. Perfect. When we were at COSM, they talked about medical tourism, which is thriving. A lot of people visit other countries, you know, sometimes they want to save money and or have a destination recovery, and you just got to be careful. And they talked about creating a position statement for things like that. I think one of the things that we need to do is more videos we have by prominent doctors that we put out there, the high quality procedures that are available, is going to let people know that they've got options and they don't have to go just for the bottom dollar treatment, because, you know, it's hard to get follow-up. There's a lot of challenges that are not talked about in medical tourism. Okay, so we're done on this side. Yvonne, how are we feeling, dear? You doing okay?
Can I just move my
Yeah, we're gonna
arm?
have, move your arms around. That's fine. And what we're gonna do is we're gonna move, just keep your
My
arms
left
below.
arm?
Yeah, you can move it underneath. That's fine to move it around. And we're gonna see you guys in the next video. Thank you all for watching. More videos coming soon.